So among the treatment options, you spoke about transcatheter aortic valve replacement or TAVR. Please tell us more about it. What is this procedure and how it is done? As you mentioned, it's relatively new.
Yeah. So if we go historically, up till say 15 years back, we had only one way to treat the valves, that was a surgical replacement or surgical repair of valve. The repair of valve is not possible with the aortic valve, but repair of valve is possible with the mitral valve, where leakage is there in some subsets, not in all subsets. If the valves, which usually are highly deformed, if the valve is deformed, it had to be a surgical valve replacement up till 15 years back. So what happened? There were many subsets who were highly vulnerable and are at very high risk for a surgical valve replacement. So we were not able to offer a surgical valve replacement in such patients because they were high risk, and the mortality could happen and patient may not come out of a surgical procedure. So those patients were actually dying, and we didn't have any option. So then this procedure came, which is known as TAVR, that scientists all across the globe, they were looking at that, can we replace the valve without surgery? It happened. It's an intricate procedure, but then over the time now, data is getting more and more in favor of this procedure. The whole procedure is done through an access in the artery, which is usually taken from the groin. No surgery, no cut on the chest, no incision done, no blood loss. So this is our heart. As I mentioned, there are two valves on the left side. I'm just showing with the arrow. So this is the aortic valve. This is the aortic valve. It has three cusps. So it opens like this, like a fish mouth. Now this is a normal valve. Okay, so as I was mentioning, see, the valve is now becoming thickened. Over years and years of this hard work, everybody wants a rest, but heart doesn't take any rest. So this is how we do a procedure. As I mentioned, that we take access from the groin. This is the access point into the artery. And through this, now this hardware, after doing 2-3 initial steps before this, through this access, this hardware is getting advanced into the artery, femoral artery, iliac artery, and then into the aorta, which is the main artery of the heart, and then we reach that place where the valve is diseased. This hardware is positioned across that aortic valve, and this is deployed like, now this is not a good position. Now somehow the hardware is made in such a manner that we can always reposition. So like the previous opening, we have repositioned. This is a good position. And once we are comfortable with the position, we deploy this valve. So now you see the diseased valve gets compressed or squeezed beneath the rim, which contains the newer valve. Now, as soon as we deploy this valve, the newer valve starts functioning immediately and gives a big relief. This is a simplified explanation. I think this would be pretty handy for our audience.